Hello everyone, I am Dr. Khalid Saifullah and I am talking from the Bangladesh, and today I am making the blog about my overseas friend, those who are asking about the depression and its management and how to manage the total procedure. And today I am talking about from the Chokriya Cox's Bazar. This is the seaside area of the Bangladesh, and I am talking from the green field. And this is the time of the morning, and it's about 8:30 in here in the local time, Bangladesh. So some of the patients from the overseas, they asking me that they don't understand my Bengali. Actually, I'm trying to talk with some patients that their native language is in Bangladesh, so I talk about in Bengali. So today onwards I will post my live some live on English for the international people, and sometime I will post it in English, so that will help. So later I will notify my audience about the blog that which I'm gonna say in English and which one I'm gonna say it in Bengali. So today the topics that a lot of friends from the overseas, they are asking me about the depression. And actually the problem is the depression, this is the mostly mental hazard all over the Bangladesh and also the worldwide. So we see patients from different discipline like Bengali and sorry, my bad. A lot of the patients, they are from the different discipline, like they are suffering from the heart disease and diabetes and some chronic disease. So let's jump into the topics. That I am talking from the green field, and there is a farmer is working in the morning. And by the way, today is my 48 days on morning working days. Some of the people around the world, they are seeing me on live every day, so they are enjoying, and someone is already started working with me. Today is my 48th day in the morning working. It's around 6 to 8 kilometers, and yesterday I remembered I already crossed around 13 kilometers all over. So let's jump into the depression. So if we talk about the depression, as you can see, that is a more common and serious mental health condition that affects our feeling, think, and handling daily activities. So the important thing to remember that is for the informational purpose, that there should be professional medical advice, diagnosis, and treatment in terms of the depression. If we need the treatment, you must to go to the physician, and they will assess your mental condition, and then thereafter you're gonna get some therapy, or if the therapy is not enough, then we go for some treatment procedure. So here if we go for the definition, the depression is subdivided into 2 or 3 types. Actually, the depression, we call it in medical science, is the major depressive disorder or clinical depression. Actually, this is gonna the patient who is suffering from the depression, they persistently it lasts from the weeks to the months, even years. So actually it causes the severe symptoms, like common symptoms with the depression is like emotional and psychological symptoms. So what is the emotional and psychological symptoms? Actually this thing is like the persistently anxious and the empty mood, that there is the feeling of the hopelessness and feeling like nothing will ever gonna get better, and the irritability, sometimes frustration, and the restlessness. So all together, and sometimes feeling of the guilt. So this is the common criteria for the depression, that some people feeling helplessness and the sometimes hard criticism or the perceived faults, and that actually, like they lost the interest on the daily activities, like difficulty thinking, and they no longer interest in the physical activities. So in the meantime, I can show you that from the green field there is a lot of farmers. They are working in their ground field. They started very early morning, so you can see the green vegetables is from the Bangladesh, and the fresh one, some product, and some of these vegetables sometimes exported to the over the overseas country from this field ground. So as you can see that as far as my vision goes, that the people is working here. There's a lot kind of vegetables, fresh vegetables they are growing here. And actually the thing that they woke up very early in morning and they started working in the field for nurture this kind of the vegetables. So here we go, and now we can come to the topics that actually, like the people who prone to the depression, they used to have lot of sleeping, sometimes no sleeping, and sometimes they started eating lot of food, and the decreased appetite, and sometimes they feel the lot of pains over the body and headaches, and sometimes the abdominal cramps. So actually this is the treatable condition. Don't worry about the actually I'm going through the medical terms, and that I think sounds some difficult for some patient. And actually we all have some kind of depression, and any type of our life circle, we sometimes get depressed. So which formation of the depression, and we divide it into some criteria, like there is the major depressive disorder, that is the severe symptoms that actually persist, interfere with our daily life. And if we go for the persistent depressive disorder, that is we call in the medical term is the dysthymia. Actually the depressed mood that lasts longer, more than years. So we're gonna say it persistent depressive disorder. So how we categorize this kind of the depression and how we treat that condition, and also the pregnant mother, sometimes the postpartum and the peripartum, there is also we can see the some kind of depression, and after the baby born, maybe after 2 to 3 days, and we categorized that kind of the depression into the so many types. So, and there is another one, the seasonal affective disorder, like the patient feel depression in the different season of the year. And this is hopefully we find a lot of patients on this, that if the winter comes, or sometimes they feel better in summer, but they feel so depressed during some winter days, or sometimes maybe on that actually affects the patients on the seasonal basis. So we can say it the seasonal connection with that kind of the depression. So actually the depression actually does not have a single causes, that genetic and the biological and environmental psychological factor. So what happens in the depression, if we cut it into some pieces, so we can see the brain chemistry. In our brain there is a lot of neurotransmitter, as you know, the serotonin and some hormone like non-epinephrine and the dopamine. As you can maybe heard of these terms, so depression can run in also in this